Mongolian pinch method for diabetes. Patients who have been told they have type 2 diabetes should follow these steps to do the pinch therapy. People who like the pinch method say that the wrist is gently pressed between the thumb and index finger of one hand. Some studies have found that increasing the amount of insulin in the body may speed up the process of breaking down glucose into its parts. People who support the practice think that it should be a normal part of life, no matter how high or low a person's blood sugar is at the moment. This is how people who think the practice should be encouraged see it. Is there any proof that it works, even though trying it out won't be a waste of time? When it comes to type 2 diabetes, does pinching help in any way? Diabetes has never been treated with the so-called pinch method, in which a person quickly lowers their blood sugar levels to reset them. This is because no one has ever tried the method. This method is also called pinching by many people. There is a thing called the placebo effect, and it is almost certain that it is what caused any positive effects to be seen. Even though there are no known risks to a finger prick test, it could delay treatment for a dangerously high blood sugar level, which could kill the person. Even though there are no known risks with a finger prick test, this is still the case. Even though there are no known risks associated with a finger prick test, this is what happens. Because of this, people should be careful about relying on information they find online about complementary therapies, like the one this article is about, because the information may not be correct. By themselves, acupressure treatments won't improve the body's ability to use glucose or make it make more insulin. When the system is used, it shows a number of problems that were not thought of when it was designed and that come up as a result of using the system. It has also been thought that self-acupressure can cause the body to make more insulin and lower its blood sugar levels. People with diabetes would benefit from this. In China, traditional acupressure has been used for thousands of years. As part of this practice, acupuncture needles have been put into patients' meridians during this time. The street 36 point is 3 centimeters below the kneecap and 1 centimeter from the edge of the tibial plateau on the side. To put it another way, it is right in the middle of the tibial plateau. About 5 centimeters in front of the internal tibial angle of the shin is where the SP6 is placed. The dorsiflexion flexors live in the live 3 area of the finger, which is between the first and second knuckles. The spot where KD3 is somewhere between the middle of the calf muscle and the Achilles tendon. Each person took a total of 5 minutes to learn the technique and then try it out on the different acupressure points. This was done so that the people who took part in the activity could get the most out of it as possible. When combined with hypnotherapy and TM, it was found to be very effective at lowering the amount of sugar in the blood. This method has nothing in common with the pinch method, and it should never be used on its own outside of a management program that is being overseen by a practitioner of complementary medicine with the right training. Self-acupressure can't replace tried and true ways to control blood sugar levels. On the other hand, if you want to find new ways to control your diabetes, you might want to look into this option. Diabetes is a long-term condition that needs to be managed and watched over all the time.